Good evening, everyone. I'm glad to welcome you all to this Women's Health, Hormone Imbalance, and Mental Health program. Hormones play many important roles in a woman's health. Studies have shown that certain hormonal deficiencies can affect mental health. Hormonal balance is vital to a healthy mind and body. Today, Dr. Senthilkumar, MD from Beaumont Health Center, is joining us to present about women's health. In this talk, she will present an evidence-based integrative medicine approach, mind, body, and spirit. We will learn the use of less invasive, safe interventions to address hormonal imbalance to achieve optimal health and healing. This includes lifestyle, diet, yoga, meditation, and much more. Please use our questions and answer feature if you have any questions. Dr. Senthilkumar will answer your questions at the end of this presentation. Let us now welcome Dr. Senthilkumar. Hello, Dr. Senthilkumar. Thank you very much for being with us today. Our patrons are eagerly waiting to hear your presentation. Let me hand it over to you. We will be recording this presentation and post it on our YouTube page for your later viewing and reference. Thank you.
Directly that are directly secreted into the blood by the specialized glands called as endocrine glands, right? These hormones are carried to different organs and tissues to the body to exert their functions. So these endocrine glands play a very vital role in one's physical health and mental health. So there are many types of hormones and that act on different bodily functions. Say, for example, hormones help in growth and development, and they help in metabolism, they help in appetite, and they help in sexual function and reproductive health. And most importantly, they help in cognition, cognitive function, and mood. So also they maintain what we call as homeostasis. This is nothing but maintaining the physiological equilibrium, that is maintaining the balance inside of our body, right? When this is not present, when the balance is not achieved, a lot of things can go wrong. So when something is out of balance with your hormones, it affects the whole system, which means you're going to feel it manifest both in your body as well as in your mind. So it's so important that we have to keep these hormones in balance, and we're going to talk how we can do this as we move forward in this lecture, okay? So let's quickly learn how hormones work in our body. So this is basically hormones, as I said, like the chemical messengers that tell our body what to do, when to do it, and how long to do it. Small changes in the hormones can make a lot of difference, right? So hormones travel in your bloodstream, and each cell has a specific site for the hormone to come and attach. So they usually have different receptors in this. These are called as receptors. The site where the hormone attaches are called receptors, and each cell has multiple receptors. So many hormones can come and act on the cell. So usually the hormones come and attach to the cell. It's more like a jigsaw or a lock and key. They come and click together. Once it clicks on the cell, it triggers a chain of reaction and causes an action in that cell. Okay, that's how the hormones work. So, and most importantly, we think hormones are, the endocrine system, but they work so closely with the nervous system. The nervous system, if they get affected, like emotionally, when we are, not in balance, then that affects our hormone production. And that's what we are going to learn how to rectify that or correct that. So there are so many hormones in our body. These are the list of things I have here. Definitely, I'm not going to quiz you on this end of the lecture, so don't worry. All we have to learn here today is what are the major hormones that affect us in our mood level or disturb our mental health. So let's focus on that for today. The main ones are, as we know, like what are the main ones that really affect our mental health is estrogen and progesterone, the two biggies we always talk about as women. right? So estrogen and progesterone, they are, during reproductive years, the ovaries contribute to major production of the estrogen and progesterone in our body. So the estrogen peaks during the beginning of the cycle of the menses, and then the progesterone peaks after the ovulation, okay? So some amount of it is made also by different glands in the body, not just the ovaries. There is something called as adrenal glands that sits on top of your kidneys, which we will talk when we move forward. And some estrogen are also made in the fat cells, okay? So estrogen, progesterone, and the testosterone are these three hormones that are involved in both puberty and our reproductive health most generally, okay? These hormones impact our mood and affect our mental health very much, okay? So puberty causes our hormones to fly all over the place. Often we will experience the surge of hormones, and this can cause low mood and anxiety in many people. And talking about estrogen, if we have too much of it, we often feel irritable and anxious. And if we have too little of it, we are going to be tearful and in low mood. Talking about progesterone, they work on certain sites called as GABA receptors, GABA receptors. These receptors are like, they give a sense of calm to you. So when we don't have enough progesterone, that calmness goes away. We get more anxious, we get sleeplessness, those things will happen. And testosterone, we often think this is a male hormone, but no. This is present in both genders, okay? It is very important for us to have a balanced amount of the male hormones and female hormones to have a good bodily function. So if we do not have enough testosterone, then our motivation and mood tend to drop and our anxiety level goes up. So the next slide quickly tells you how we, as I told you before, like how the estrogen peaks during the ovulation, and then after ovulation, the progesterone comes up. So that's the picture here. And then the next slide here, it shows like how we lose estrogen as we age. Like we have a lot of estrogen between our 20s and 40s, and then we hit 40, it slowly fades down, and then it levels out at one point. We don't have much estrogen in the body. So, and we need to talk about something called as premenstrual symptoms. I mean, who doesn't have this, right? Like everyone who have period will know what they can play games with our mood, right? The premenstrual symptoms. They can leave us feeling tearful, irritated, low, anxious, and wobbly. Sometimes, all they want to do is sit and cry and nap. So those are very typical premenstrual symptoms. So, and some people have a little extreme of that. We call it premenstrual dysphoric disorder, which is PMDD. So those are little more significant mood changes that happen during the cycle, which needs medical intervention. So for premenstrual symptoms, usually I will talk about the treatments as we move along, but there are specific things we can do to kind of prep our body towards having the period. And that will help us alleviate some of the premenstrual symptoms we will face during our periods. So then what is perimenopause? So perimenopause is nothing but the time from when the symptoms start lasting to 1 year after your last menstrual period, okay? So after you have the last menstrual period, the time from that to 1 year is your perimenopause, where you will have increased premenstrual symptoms. You will have prolonged period or less frequent periods, or heavy bleeding, light bleeding, all of that. Hot flashes will start happening, night sweats will start happening. And what happens at this time is the ovaries start, decreasing the production of estrogen around the perimenopause period, which leads to increase in LH and FSH. Those two are the hormones that kind of give a push to the ovaries to make more estrogen. But because the ovaries are shrinking, they don't have the capacity to do as much, but they just, kind of in burst of estrogen they release, and that causes hot flashes as we go to that stage of life. And progesterone level also goes down because, remember, as I said, only ovulation can make progesterone. So if you're not ovulating, your progesterone levels go down. So that's something important we need to remember. So this slide here, this is about the menopause. I definitely have to talk about this topic because not a single week goes in my clinic without seeing a patient complaining of this symptoms, because it is so common and people have real suffering with this menopause. Okay, so we really need to learn what they are and how we can alleviate some of those by changing our lifestyles. We will talk about it. So symptoms of menopause are, we can have hot flashes, night sweats, your heartbeat goes up and you have trouble sleeping, you have short period, lighter period, and sometimes even phantom periods. And then you have loss of libido and anxiety, sensation of doom, having sensation of apprehension, the dread. These all happen around the menopause time. So again, if you have other issues on top of the menopause, like low thyroid, or if your adrenal glands are not healthy, then your menopause symptoms goes really worse. So we have to remember that we need to keep all our major hormones in balance for us to have a healthy and peaceful aging. So when we talk about aging, I really want to mention that as we age, our hormone levels goes different, right? The progesterone levels go down when we hit age around 35, and then which leads to high cortisol levels. Cortisols are stress hormones. We will talk about it. So when there is high cortisol level in our body, we have more anxiety, sleeplessness. And in our mid-40s, we also kind of tend to produce less melatonin, which is one of the sleep hormone. The sleep hormone, when it goes down, it really messes up our regular sleep cycle. So moving on to another major gland, I want to talk about this in a little elaborate way, because this is the important gland that we need to hold on to as we age. Because adrenal glands come in handy when the ovaries, fail to produce the estrogen and progesterone as we age. The adrenals kind of kick in. So what are adrenal glands? As you see in this picture, these are two tiny almond-shaped glands that sit on top of each kidneys on both sides, and they produce different hormones. The major ones are the cortisol. The cortisol is otherwise called as the stress hormone. It is very vital for our fight and flight reflex. And most cells have the cortisol receptors, or the sites in which the cortisol can do action. So because most cells in our body have that, if you have more cortisol, then the action of the cortisol goes up in the body. So that causes a lot of stress in our body. And also cortisol interferes with some of our happy hormones like serotonin, dopamine, endorphins. Those are happy hormones. Cortisol interferes with those happy hormones, and thus it messes up our mood also. So it is important to have a balanced cortisol level in our body to have a state of calm in us. And then the adrenal glands also secrete the other hormones called as estrogen, testosterone, as I said before, and then the progesterone. These things are also, the sex hormones are also secreted by the adrenal glands. So as I said, as we age, ovaries make less estrogen and progesterone, and adrenals pick up the slack. So you have to understand, healthier the adrenal glands, easier the transition to menopause. So what we have to do is save our adrenal glands. So that really comes in handy when we age. So what happens during acute stress? So when we have more stress in our body, more stress hormones are produced, which is the cortisol. When there is high cortisol, which is really, really good in acute conditions, say for example, house is on fire, or if you come in contact with the lion eye to eye, obviously we need to have that stress response and the reflex response, and we need to run. So the blood is shunted to our legs and we run. So those kind of flight and fight response is really important in our body when there is an acute stress, right? See, also the cortisol helps in repairing all the inflammation and respond to the injury that happens inside of us. So it is good in short periods. But when we have chronic stress and that leads to high cortisol levels, a lot of things go wrong in our body. That includes number one, your blood sugar goes up, leading to diabetes, and then the abdominal obesity kicks in, leading to high cholesterol, high blood pressure, all of that problems. And then when there is high cortisol or the stress hormone in your body, it decreases the production of the sex hormones. So because everything is diverted to make the cortisol, so the other hormones made by the adrenal glands are less. So obviously lowers the sex hormones and therefore, less libido. So eventually what we have to understand is whenever there is a high stress environment, the cortisol level goes up. Okay, the adrenal keeps giving more and more cortisol, but at one point, that's all, they get exhausted. The adrenal goes into exhaustion and then it stops making that cortisol. That is not a good sign. We medically call this as adrenal fatigue, meaning that the adrenal glands give in or give up. So, and they don't make any more cortisol. So that leads to low cortisol, low testosterone, low estrogen, and therefore all these symptoms like fatigue, hair loss, joint pain, inflammation, all these autoimmune disorders like Hashimoto's thyroiditis, lupus, whatnot, all these autoimmune disorders, allergies, chronic allergies, frequent infections, they all kick in when you have adrenal fatigue. As I said earlier, adrenal glands are paramount important and you have to save them as we age. So that's all about the adrenal glands. Hope I'm not going too fast. And again, if you have any questions, please jot it down. We will talk about it. And next is the thyroid gland. This is also another important gland that sits on your neck. Okay, it makes thyroid hormones. Thyroid hormones are of two types, T4 and T3. So they, as you see, for making the thyroid hormone, we need a lot of vitamin B1, B6, and then this vitamin C, tyrosine, zinc, and that produces the T4. And T4 is the inactive hormone. It needs progesterone and selenium to be converted to the active hormone to do its action in the body. So it's you can see the link here itself, how progesterone is important to make thyroid. And thyroid is the hormone that energizes and metabolizes most of the things in your body. So it's a paramount important hormone. And we see thyroid issues in every third person in this country because it has become such a common disease in this country. Most of the time it is due to this Hashimoto's thyroiditis, which is an autoimmune disorder because of chronic inflammation and chronic stress. So symptoms of low thyroid can lead to constipation, fatigue, depression, menstrual disorders, severe menopause symptoms, hair loss, dry skin, all of that. So there is a huge link as of now. You can see how thyroid, your female hormones and your adrenal glands, they're all linked in to give you a sense of well-being. So we have to understand that we have to keep all our hormones in balance to feel good within ourselves. So let's talk a little bit about stress and the hormones. I mean, who does not have stress here, right? Everyone is going through some kind of stress in their life, and any stress can lead to hormonal imbalance. So what happens is, as I said again, there is this stress brain loop. Anytime you have inadequate sleep or emotional stressors, poor nutrition, any of these stressors or external triggers can cause secretion of more cortisol in your body. So more the cortisol, it really interferes with the production of other hormones. What happens is more inflammation happens in your body. When inflammation happens, they stop the conversion of T4 to T3. And T3 is the active hormone. Without active hormone, your body is not going to have the benefits of thyroid. And stress causes estrogen to go up and then progesterone to go down. So high estrogen and low progesterone level is very similar to a menopause state. So whoever is going through a lot of stress, they are already in the menopausal state based on their hormonal levels. So chronic stress is not good for that also. And then the stress, adrenal fatigue, and premenopause, menopause, all of this cause low progesterone. And this affects your thyroid. So you cannot balance your thyroid gland without balancing the other hormones. So it is really important. We have to understand this is all linked as one. So you cannot, if someone has a hypothyroidism, it is not as simple as, okay, take a supplement a levothyroxine and your levels will come up. It is just not like, quick fix thing. You have to see it as a whole picture, a comprehensive analysis, and then understand what is lacking and how we need to bring that into balance. You have to see it as a holistic picture, not just as a single problem, because our body is not a single, every gland is not functioning as a single unit. It's a whole unit. So we have to see it in total. So a little bit about the sleep disorders as we age and what are the hormonal changes that we go through when we age. So sleep is completely dependent on the hormones that's called as melatonin. And melatonin, as I said, it sets up our circadian rhythm, and it decides when we need to be awake and when we need to be sleeping. So the melatonin secretion is very much dependent on the daylight. And whenever it is dark, our pineal gland, which is a gland in the brain that produces the melatonin, that hormone makes us sleepy. So as it gets light during the day, we stop producing the melatonin and we wake up again. But that's not the only hormone. There is another one called as adenosine, which also helps with the sleep. So adenosine, when it binds to a cell, it kind of calms the nerves down and we tend to go sleepy. But that's why one of the reasons we also say that don't drink too much caffeinated drinks or coffee, because this binds with the same receptor as the adenosine, and it does not allow the action of the adenosine to happen. So there is no sense of calm. The nervous calmness doesn't come down. The nerve cell activity does not slow down. So we still, caffeine really speeds you up. So we feel more awake when we take too much coffee. So again, sleep has a huge impact on our mood. When we know that, like we all know that how distorted we feel after a broken night's sleep or too many late nights in a row, right? Our mood drops, our patience evaporates, and then we become very snappy and more irritable. So sleep is paramount importance. Like it has to be a part of the prescription, I strongly believe. So let's talk about a little on the treatment approaches for different things we discussed so far. Again, I don't want to take this as the prescription and just do it without consulting a doctor. I really want, if any of you are going through any of the symptoms, I definitely want all of you to reach out to your primary care provider, talk to them, and then go from there. So treatment approaches for perimenopause, as I said, we have to understand, are we really like healthy? How do you know if you're really healthy? So I strongly believe that, one who has a good bowel movement is the healthiest person. So please don't laugh if you're listening to this. So because anyone who has a regular bowel movement, when I say regular, you should not have any constipation. Some people have regular bowel movement, but it's not like a easy thing for them. They have to sit for hours together in the restroom to have a bowel movement. That's not a good sign. So anyone who has a regular bowel movement, they have a good gut microbiome. And gut microbiome is a big topic. So we call the microbiome, the gut bacteria, as a second brain, so they dictate how we are going to be functioning. So it is very important to keep the gut microbiome in balance. So I strongly feel everything starts in the gut. And how does the gut microbiome set? It depends on what we eat. So our nutrition is the important factor to keep our microbacteria in balance. So coming to the treatment for perimenopause, we normally use this supplement called as Vitex. It is one of the herbal supplement. It is chaste tree berries. This really balances the estrogen and progesterone. And we can also use a compounded progesterone cream for hot flashes and other symptoms of perimenopause. And then coming to menopause, see, menopause, again, we can use supplements. Apart from that, I strongly believe in other mindful techniques, which I talk about. So black cohosh, which is called as remifemin, which is very useful in menopausal symptoms. And we also use phytoestrogens or isoflavones from products like soy products, kuchu. Those are like really nice products to take on an everyday basis to avoid symptoms of, menopause. And then I know soy has a lot of controversies there, but the exact mechanism of soy is not known, but it definitely has a way to block the harsh estrogens. Okay. So apart from these supplements, I strongly believe on this mind-body medicine, which has shown a lot of data scientifically that relaxation techniques, and then writing like self-suggestion of good thoughts on every day, like journaling, and then trying like slow, deep breathing. This is like a huge study that was recently I came across a scientific paper that said that people who practiced slow and deep breathing every day for 15 minutes showed tremendous improvement in hot flashes throughout the course. So it's important that you sit down and do these techniques on a regular basis. I will teach some of them as we move along. So definitely relaxation techniques and deep breathing exercises have proven a great benefit in hot flashes, because hot flashes happen because of the nervous stimulation there. So you need to calm your nerves to kind of bring the symptoms back to balance. And treatment approaches for low thyroid, you can supplement with iodine, zinc, selenium, and then the Brazil nuts. Brazil nuts have a lot of selenium in them, so you can take them on a regular basis. And then if supplements are not enough, definitely you can go for like a synthetic version of T4, T3, or you can take natural thyroid hormones also. And then for people who have abdominal cramping or a sense of weakness around their menstrual cycle, like the premenstrual symptoms, I suggest taking the CCF tea, which is made of 3 seeds. It's cumin seeds, coriander seeds, and the fennel seeds. That's why it's called the CCF. This is really a great remedy for the cramping and also for the pelvic pain you get around the period. The tea is made with the seeds added in the water, like 1 cup of water with 1 teaspoon of each seed, and then you boil it and then you bring it down to half, and then you drink it like a tea in the morning. Just add some sweetener if you like, and then drink it like a tea, and it really strengthens your pelvic muscle, reduces the cramping, because fennel seeds really help in relaxing your pelvic muscle. So it helps with the cramping. So it's definitely a good try. And then moving on, so treatment of adrenal fatigue. As I told you, like adrenal fatigue is a big deal. It messes up a whole lot of things in our body and mind. So herbs like, adaptogens. Adaptogens are plants or, supplements that really help to fight the stress that our body goes through and retrieves the normal.
Sorry, Uma, to interrupt you. Somebody just chatted. Can you write out the supplements? It's hard to understand the names. When you're talking about supplements, can you please write it on the chat also? Then they will know what are those supplements.
Oh, absolutely. I can, send all these details, all the supplement names, like as a chat at the end of the lecture. Is that okay?
Sure. Thanks.
Okay, definitely, yes. So I know I might be going in a rapid speed. So definitely I will name these list of things that I'm talking to you. So don't worry if you missed anything. So for adrenal fatigue, as I was telling you, we recommend taking adaptogens. Adaptogens are like, they really calm your body and they help you to fight that stress your body goes through. So main ones are like rhodiola herbs, and ashwagandha. It's really good. And then, ginseng, it's another one. We normally commonly we use all those herbs. And supplementing the right amount of vitamins like B6, B12, and vitamin D, those are important. And L-tyrosine is a really good for depression and low energy. So that's another good try. And licorice root. Licorice is very good for inflammatory conditions. Again, as I give you these supplements, you have to understand that they do interact with any other medications that you might be taking for other reasons. So that's why I always recommend talk to your primary care or to an integrative medicine specialist. They can see if you are going to really benefit from that, or if you're going to have any interaction with the other things that you're taking. So you just have to be careful, even though they are supplement. They do have their adverse, reactions and side effects. So we have to be careful on how much we are taking and how we are taking. Okay. So other lifestyle factors to address the adrenal fatigue are like nutrition. So low sugar is really important. Sugar is one of we call it as a white poison. So never use white sugar. I always recommend my patients to use like brown sugar or like the palm sugar, which are like natural sources of sugar. White sugar is made of, it has to be made white with adding so many, chemicals and processing to make it white. So it's not like a healthy option. That's why we call it as white poison. So no sugar, no white sugar, but again, taking less sugar in your diet and not skipping the meals is important. Stress management, physical and emotional stress management is important for adrenal health. Sleep, 7 to 9 hours of sleep, if possible, or at least 7 hours every day, undisturbed sleep. And regular movement, it can be an exercise of any form, not too much, not too little, but in a moderate amount every day. Consistency goes a long way. So we have to do all this consistently. And then remove the toxins like, caffeine, too much alcohol, smoking, any other recreational drugs, or like environmental toxins, the pesticides, so that should be removed on a daily basis. These are like, conservative ways of helping your adrenal glands. So other things are like, as I said, daily deep breathing exercises, like at least for, 5 minutes, nothing more. 5 minutes. I highly recommend this breathing called as 4-7-8 breathing. This I learned it when I did my integrative medicine fellowship. 4-7-8 breathing is a breathing that is done just 4 times only daily. You do 4 counts of inhalation. You count 1, 2, 3, 4. You inhale and then you hold your breath for 7 counts. You count 7 in your mind and then you let go of your breath through your mouth 8 counts. And this is done for 4 cycles. Okay. So this gives such a sense of, calmness if you do it on an everyday basis. So just like doing it here and there doesn't really give you a benefit. Any habit, it has to be consistently done to see the bigger results. Okay. I'm sure some of you have read this book called Atomic Habits. The small habits go a long way. So just do it every day and you will definitely see the benefit of the habit after a good amount of time. And then creating a pre-bedtime ritual, like spend that extra 10 minutes or 15 minutes before your bedtime to kind of care for your body. That's kind of a me time. You will not touch your phone. You will not touch any electronic gadgets. You will sit with yourself, try to massage your feet because it has helped you walk all day. So massage your feet, always wash your feet with warm water before going to bed. That itself calms you down. And then apply some nice hot oil. I usually recommend sesame oil. So if you can nicely apply that oil on your feet, on all these joints, like knee joint, elbows, and then, read a book or do this 4-7-8 breathing I just told you, and then sleep. So having like a self-care ritual every night before your bed, that really gives you such a sense of clarity when you wake up in the morning. And try to spend time in the nature, simply walking or even like sitting and looking far away, because as these days we are only having like a near vision, we look at the screen most of the times, we all are using the far side. So looking long distance and looking at greenery, which might be a hard thing in winter in Michigan, but whenever you can try to see some green, look far for the green, okay? That kind of helps, relax your eyes. And taking a break from the screen, like, rubbing your hands, for 10 seconds and keeping the warm palms and cupping it over your eyes gives you a good relaxation around your eye muscles. So that's something you can do. These are all like small techniques I'm telling you to reduce your stress level on a daily basis. And then journaling your worries and anxieties helps you to vent out all your, worries. And then meditation, as I told you, after the 4-7-8 breathing, if that's not working for you, there are different apps these days that help you to meditate every day. One such app is Calm, CALM. It's excellent. And then Headspace is really good. And then Breath. These are all nice apps that you can use. And then there are also some nice free videos that you can see on YouTube for meditation practices. And then maybe you can turn on to an art if you like drawing, if you like dancing, use that as a stress relief. And then embracing, other physical activities like yoga, Tai Chi, before bed or when you wake up, whatever works for you. And integration of, short stress relief activities throughout the day. As I said, like take break from your long work day here and there, joining a support group, sometimes that really helps. A support group shows you that you are not alone, and that others have experienced similar struggles and they can provide their insight, which might be very valuable. So joining a support group is always a great idea. And be sure to have your hormone levels checked, periodically, and take medications as prescribed. So, and then as I told you before, avoiding inflammation is another thing which we spoke about. Avoiding all inflammatory foods, meaning that anything that is processed is going to be an inflammatory food. A food should contain a lot of juice in it, okay? When you squeeze it, it should be juicy. That's a healthy food, I would say. I mean, think about, fresh fruits and vegetables, and anti-inflammatory foods will have very less ingredients or no ingredients, like fresh vegetables and fruits, So anti-inflammatory food should be a choice. And I have given a pyramid of, anti-inflammatory food here. And again, I can ask Uma to share this with you, and you can take a look at list of things that are really going to help you fight that inflammation in your body, because inflammation is the reason for most of the hormone imbalance or stress. So we need to address that by taking the right food in the right way. And then studies have shown that stress-induced inflammation can be addressed by stress reduction techniques, such as, again, breathing exercise and meditation. So in the end, I want to say one thing: the mind and body are interconnected. And rather than thinking of them as like two separate things, which they are not, it is only smart to think of them as one machine with many moving parts, okay? So again, hormones are not all doom and gloom. They have negative effect on our mental health. They will definitely have a positive effect on our mental health too. So we have to make sure that, we speak to your doctor about all your physical and mental health symptoms and adopt a holistic, healthy lifestyle that can support your mental health. In addition to speaking with your healthcare providers about your physical and mental health or any medications that you're taking, you will also want to invest in healthy lifestyle habits that can support your mental health. Okay, for example, if you're tired of doing things all the time and cannot work out or engage in the activities you really like to do, your mood will definitely take a big hit, and that leads to depression, which leads to more fatigue. So this cycle has to be broken, and it can be broken only by embracing like daily stress management techniques that tells your nervous system to put a big break on all that all-consuming fight and flight mode. Okay, so my final words on the hormones are like, definitely, having an imbalance in the hormones can cause depression, anxiety, feelings of loneliness, low self-worth, and all of that. We have to challenge ourselves in the form of physical activity, meditation, and simply taking up a new hobby, and of course, reaching out to other people for help, not only just to have fun, but also to share your, burden with them. So it is a holistic way of approaching the mental health when it comes to hormonal imbalance. So last but not the least, keep in mind that our hormones and emotions greatly determine the quality of our life. And if you feel like hopeless and cannot able to try any of the suggested activities, I would definitely consider reaching out for help, because you're not alone. And these are my references. And I truly thank each and every one of you for being here today and patiently listening to me. And I'm happy to take any questions that you will have.
Oh,
Thank you.
thank you. Thank you very much, Uma, Dr. Uma, and I really appreciate it. And it's really very good information you gave us. Certain medicines, like a natural herbal medicines you have mentioned while you were presenting, and some of them I am really familiar with. One of that was Ashwagandha. Ashwagandha, a lot of our patrons may not know, this is an Ayurvedic medicine. My father and my sister, they both are Ayurvedic doctors, and my father is no more, but my sister is still practicing. So Ashwagandha is something I am familiar with it, and thank you very much. I have two daughters, those who are going through these hormonal changes, younger daughters. So definitely I will let them know. And there are so many questions here, and maybe I will read it out one by one, and so you can answer these questions, Doctor. If
Absolutely.
probiotics, is there a time limit to how long we can take it for, or could we take it for the rest of our lives theoretically?
So probiotics are definitely a good option if your gut microbiome is disturbed. So what we do in integrative medicine practice is to check stool analysis to see if there is any imbalance in the bacteria. Most of the times we see yeast growth in them, or some of the times the good bacteria is kind of very low. So it's not a bad idea to do a stool analysis just to kind of know where you are and supplement the right kind of probiotic. And we have to pick the right amount of bacteria in the probiotic also. It should be about like 30 or 50 billion. Most of these good probiotics are actually refrigerated so that the cultures don't die. So you have to pick the right brand to have the good effect. See, apart from the supplements, I strongly believe in natural way of taking the probiotics, which could be, the yogurt, like, the regular cup yogurts we buy, they're rich in probiotics. And then taking these tempeh or soap products, these are really, really rich in probiotics. And even taking like beet juice, those are rich in probiotics. So try to go a natural way of supplementing the probiotics unless you have really a bad imbalance in your gut bacteria. And you can take it, I mean, if it is a supplement, we usually go for 3 to 6 months timeline. And and again, we'll see how we are doing symptomatically. And clinically, if you're fine, then we can ask you to switch to, daily food supplements rather than a pill, and then go from there.
Oh, thank you. And other question we have already answered. Can you please list the supplements for hypothyroid? Thank you. And if you can send all this information to me, and I will email to them all the attendees, Dr. Uma, or you can post it however you want to. You can share that information.
I can share the PowerPoint with the details.
Yeah, thank you very much that way. And the other question, this recording be available? Yes, it is good. First itself, I have mentioned to you, it is going to be available on our YouTube page, and you can go back and review it whenever you want. And then the other one is, how does we get hormones checked? Is this done through a blood test? Do we just ask our PCP to order it next time we get blood work done?
Yes, so hormones can be checked via blood or it can be checked via saliva. So there are different ways to check different hormones, and some of them are done on a regular conventional basis when you go to your primary care office, but some of the specialized tests are not done in the conventional side. It's done in the integrative medicine side or functional medicine specialists. They can do this specialized hormonal testing, which will give you some idea on where to start certain things.
Okay. And is there a good overall supplement to take daily? And is there anything?
Good supplement in the sense, like, it depends on what you are looking for. Like, depending on your age, do you need calcium? Do you need vitamin D? So it again depends on who you are and what you really need. You cannot generalize, take a multivitamin every day. That's not a great idea. One thing I would suggest, at least majority of the population, is during winter, try to take some vitamin D3 every day, because we all lack sun, and there is less vitamin D in all of us during the winter months, which seems to be never ending in Michigan. So definitely take some vitamin D3 every day. But the rest of the supplement, I would not suggest unless I see you in person and talk to you.
Okay, and the other question they asked you, what is the best, and where is your office, and does insurance cover hormone testing and all that? And maybe if you could put your information, if they want to come and consult with you, if you could give your information where they can come, your office, Beaumont Hospital or something, that will be great, Dr. Uma. And yeah, and then other question is, how do the hormones play a part in preventing breast cancer?
So definitely, estrogen and progesterone balance is really important, in keeping your cancer under control, because most of the cancer types that comes in the breast specifically are dominated by estrogen or imbalance in the progesterone. So there are specific types like ER/PR types. So those kind of, which is estrogen progesterone related breast cancer. So that's why, again, I say, like, having this estrogen and progesterone imbalance is of paramount importance in breast cancer.
Okay. And what is the recommended amount of caffeine each day? How much? I drink a lot of coffee, Uma. And so then I should ask you that question too. That will be helpful. How much we can take a day? Caffeine, like
I don't want to take away the caffeine from all of your life. I know it gives a good kick and it gives a good
yeah.
But again, everything in moderation is what we try to say, right? Like 1 cup a day or maximum 2 cups a day is good. As we age, we want to slow down those things.
Okay.
I mean, if you're drinking the coffee for just the flavor of it, I would say go for decaf coffee, which is not a bad option. You can get that caffeinated feel with other drinks, like, drinking a green tea, which also has some amount of caffeine, which is much better than drinking black coffee. Okay. Green tea is definitely a go-to, I would say.
Yeah, that's what they say. A lot of people say green tea is really good, right? I don't know how it is, because to prevent coffee, maybe just to avoid coffee and take most green tea, that's all. And so what is, then this one, a lot of people, as I mentioned to you in the beginning, a lot of people may not be aware of this herbal medicine, that is Ashwagandha. What is Ashwagandha taken for? That's the question. Sheila Brando asked that question. What is Ashwagandha?
Yeah, hi, Ms. Brando. This Ashwagandha is nothing but, as I said, it's an adaptogen. It really helps you to fight the stress that your body faces. And it gives a sense of calm. So adaptogens play a vital role in fighting the stress response. So Ashwagandha is taken as a powder form or a tablet form. It is nothing but it is the root of the tree. So or the bark of the tree, I would say. So it has like more like a yellowish color to it, and it comes in different ways, like a powder or like a tablet. Sometimes even it comes like a syrup. So you can take it in different forms. And if it is, it can be taken on a regular basis if you fit into the criteria of having it at least for like a year. It acts as equal to Zoloft sometimes, which is Zoloft is nothing but, your antidepressant medication. And so it can act as good as, the antidepressant. So it is a great supplement to take if there are like, signs of depression or anxiety, or, you're always on your edge. Definitely Ashwagandha is a great option.
And where will they get it, Uma? Because you see, I know I am aware of it, Ashwagandha. So I get it from India, from my sister's place. She's a doctor, Ayurvedic, but here, if we want to, they have to look in Amazon, or there any places where they can get this Ashwagandha.
Yeah, so when they come to our clinic, we do provide them with the different websites where we can buy these herbs, and some of them are Ashwagandha is available on Amazon too. So you can go to Amazon. There are some good brands that you look for, like a Banyan Botanicals. They carry a good quality product of Ashwagandha. So there are specific brands I usually recommend because you don't want to take something that is of poor quality, which definitely is not going to give you the benefit. So we have to look for the right brand. And Amazon does carry some of the good brands.
And is there any way to cut white sugar cravings? What can we do to cut out the whites? Only willpower, or what is that?
That's a great question. So yes, it is a fight with the white sugar, right? I mean, the cravings are killing, and especially if you have a long day, you want to end the day with a good amount of sweets. And I don't blame anybody who is feeling that way. So white sugar cravings are, take it slow. You don't want to like, okay, tomorrow I'm going to stop taking sugar. It doesn't work that way. Your body always, when you are hungry, your body looks for sweets. So don't allow your body to crave, but the way you can, help the craving is taking natural sweeteners like, dates, organic dates. They are like super, like the Mediterranean kind of dates, which are very juicy. And they have a lot of sugar content in them. I would say just put a date in your mouth and you would see that after some time, your craving goes down. Or fruits are the natural sweeteners, melon, yellow melon or musk melon, even eating like a cupful of grapes, sweet grapes. Those are definitely going to help you with your cravings. At the same time, it is not as bad as the white sugar. So go for the natural ways. Yeah.
Any natural ways to help glaucoma or high blood pressure?
Not sure about the glaucoma, but I can answer for the high blood pressure part. So definitely, yes, natural ways is blood pressure is more like unless you have a problem in the different parts, it is not an organic disease. High blood pressure is more like a lifestyle disease. So you have to work on the salt content, how much salt you're taking, definitely working on keeping your body weight under control. Regular physical activity, which opens up the blood vessels and then relaxes your blood vessels, the pressure goes down. So regular physical activity, and as we spoke about meditation, it really helps you to calm down. High blood pressure is one of the signs of high anxiety. So that really comes down. And no smoking. Smoking really doubles up your numbers. So definitely have to avoid cigarette smoking. And then supplement wise, I usually say, you can try moringa tea. Moringa is one of it's kind of a greens that is mostly grown in Asian countries. But it is nowadays so common even here.
Yes.
It is available, like if you go to Whole Food stores or other like health stores, you get this moringa tea, Moringa. So it comes as a tea bag or sometimes comes as a powder. So I recommend doing that because it really helps you to bring down your blood pressure. It also works good for your cholesterol. So do not take this by stopping your regular blood pressure medications, because that's the kind of medical advice I give. Do not take this as a go-to. Whatever I discussed with you today is like overall view of things, but I really want each one of you to address things with your own doctors and then make an informed decision, which is the safe way to go.
Yeah, is the Costco brand of ashwagandha one that you recommend? Is there a ashwagandha available in Costco? I'm not sure. Is
Yes,
that?
they do, but they do it as a tablet form. See, I
Okay.
personally prefer powder form, which has more, the availability of the phytochemicals in them to give a better action. The capsulated or tablet form does not have that much efficacy as the raw powder. So I mean, raw powder is super hard to take, I should be honest, because it has a strong taste to it.
Yeah.
So some people cannot tolerate that taste. So if you are not able to tolerate it, definitely go for the capsulated version. Yeah.
Okay. Any natural ways to increase libido? Did I pronounce it properly? I don't know. Libido? Libido? I'm not
So,
sure.
I mean, definitely, libido goes down if there is less physical activity. So when the happy hormones are kicked in only when you move your body,
Okay.
definitely have to work out. Okay. And then making sure, all your hormones are in place. So less libido is because of having imbalance in your hormones. So we have to check if the hormones are not in balance. So that can be done. And then see, there are some supplements, but again, we have to look it as a whole picture to see if that is another thing that you can take for the libido, because anytime you have a problem, I want to do the analysis thoroughly and then go for the treatment so that you're not missing any parts there.
Okay. Okay. Are there any other questions? I'm taking, and this is such a wonderful program, wonderful presentation, very helpful information, Dr. Uma. There is one more message. Thank you, everybody. A lot of people, thank you very, very much for sharing this information. And you won't believe, very well attended program, and also so many questions. We received a lot of questions. That means we know how important a lot of our women are going through with this hormonal imbalance, and how helpful this information. We really thankful to you, Dr. Uma. And also this and there is another, like, this is a series. It's not like a mental health we are having. It's 1, 2, 3 series. There is going to be another program on mental health. This is next month, same February 23rd at 6:30 p.m. It's about lifestyle strategies and natural therapies for mental health by Dr. Michelle Davila from Beaumont Hospital. She's a licensed naturopathic doctor with Royal Oak Beaumont Hospital, and she's going to be here for more details. You know where to go, and you go to our library's event calendar and when to register. This is next month. So I'm very, very happy that you are all attended and you got this information from our Dr. Uma Senthilkumar. Thank you very, very much, and thank you all for participating in this program. Have a good night.
Thank you all. And Uma, if anybody needs any more information, I'm happy to share my professional email ID, and you can ask them to reach out.
Could you please?
I'll be happy to help them.
Yeah. Yeah, a lot of people ask that where is your office, how can they come, and do you take insurance, and all those questions. Please, if you could provide your office email ID and information, then I will just pass it on to them. And also if you can, all those whatever the supplements and food, what they can take, and natural way how they can treat themselves. There is another one you mentioned, but I forgot to mention that. CCF, cumin, coriander, and fennel. How can they take it? This is my question. It's like a raw, because we know as an Indian origin, we know about what is cumin seeds, what are the coriander we use every day in our spices. Fennel will be a little bit bitter if they take it raw. You know that, Doctor?
No, this is not taken raw. This is like, it is available as CCFT in a bag.
Oh,
So
okay.
all you have to do is take a spoon of the seed and put it in the water, like how you make tea. So you just boil that.
Okay.
And then filter the seeds and just drink only the water. So,
oh, okay. Thank you. Thank you, Bill, for that
you're not going to
information.
eat the seeds. No.
Yeah, that's what I'm wondering. So I
You're
forgot to
making-
ask you in the beginning itself that one. And thank you very much for that. Okay. And if you could provide all that information and email to me, and immediately I'll pass it on to all our attendees. And thank you once again. And I really appreciate for your presentation and for joining us today, Dr. Uma. Thank you all.
Good evening, everybody. Bye-bye.
Good evening. Bye.